Today on the podcast, I had the honor of interviewing Dr. Scott Sherr. Dr. Scott is an internal medicine physician specializing in health optimization and metabolomics-driven clinical care. He serves as the Chief Operating Officer of Health Optimization Medicine and Practice, HOMeHOPe, and is a well-known educator. He's known for synthesizing complex topics like hyperbaric oxygen therapy and methylene blue into an easy, actionable framework. His work helps people like you and me connect the dots between their symptoms and their stress responses and simple steps that can optimize cellular energy. I really loved this podcast, and I know you will too, especially if you're still thinking to yourself, why am I still fatigued? I'll tell you how many people I've talked to who have done a laundry list of diets and supplements, and they are still so confused about their health, dealing with chronic fatigue, chronic pain, and chronic symptoms still. At Nutrition with Confidence, we do not believe in quick fixes. We help you bio-individualize your diet and lifestyle recommendations and walk you through a step-by-step process that helps you to rebuild your body and calm your nervous system through it. This helps you regain control of your health and build confidence in your ability to heal. If you're interested in finally getting to the roots of your chronic symptoms, schedule a free exploration call at Nutrition. Awesome. Well, thank you so much, Dr. Scott, for joining us today. I'd love for you to start out by telling us your story of how you came to be an integrative internal medicine doctor, but focused also on the health optimization piece.
Okay, so we can go the long story, we can go the short story. I think I'll do my best to do something of a hybrid, but I grew up the son of a chiropractor. And so my upbringing was very much out of the box, very much not a conventional upbringing. I didn't know that there were doctors outside of chiropractors until I was probably about 14 or 15 years old, because my dad was kind of like the sort of OG when it comes to alternative, functional, integrative. So people came to him for all kinds of things. It wasn't just like cracking backs and necks and off your ways. No, I came in with allergies and asthma, came in with stress and pain, or all different kinds of things. And so I grew up in this very alternative environment, very out of the box. And it was cool. I mean, everything from being adjusted when I was first born, to coloring in the front where my dad had his office, to then when I was in high school, collecting money behind the front desk. And so I had like a nice evolution of all of that. But I learned a lot of bedside manner from him over the years. He was very fast with people, but very intentional and very complete with them at the same time. So he'd spend 5 or 10 minutes with them, but he'd feel and make them feel like they were with him for a much longer period of time. And so when it was time for me to think about going to professional school, I knew I wanted to be a doctor of some sort. I really enjoyed that whole ecosystem. And then I decided, I kind of crazily, that I would become a medical doctor. And it was more like, well, I saw limitations as to what he could do as a professional, as a chiropractor. And he actually encouraged me. He's like, well, maybe get the medical degree as well. And then from there, you can figure it out. And so that's what I kind of have done over the years. I got tantalized and by all different specialties in medical school, where you could go make a lot of money when you first finish your residency, dermatology, radiation oncology, radiology, and others like that. But I always came back to this kind of idea where my hope was to figure out a way I could bridge the worlds of alternative and conventional medicine in a really cool way that was, for me, that I could be very helpful for as many people as I could. And so my first real gravitation towards was a field called hyperbaric oxygen therapy. And I learned about it in medical school, learned more about it in residency. I created an integrative practice around it once I finished my residency in internal medicine. And that slowly built over many, many years. And it became more of an integrative practice where hyperbaric therapy was what I specialized in, but I was referring people over for any number of things along the way. And one of the things I was referring out a lot was for foundational work, groundwork, as I would say, from a health optimization perspective. And this is what I would call foundational biomarkers, foundational health, because if you go into a chamber too early, sometimes you'd actually not see the benefit that you potentially would hope for. And so in 2017, I met a gentleman named Dr. Ted Achacoso, who was bringing over this framework called health optimization medicine from his clinical practice and starting a nonprofit to help train other practitioners in this framework to optimize health rather than focus on disease. And so I signed on as somebody to help start the nonprofit along with getting trained by him in the whole framework. And that became the framework that I use in clinical practice. That is the foundation of everything that I do. Because you need a foundation, all of us do. Without that foundation, everything else crumbles, or at
Mm.
least doesn't go as well as we'd like to go. And hyperbaric therapy became my inroad or my sort of through line as I started working with health optimization medicine. But now, even though I do a lot of hyperbaric medicine still, it has become its own through line in the sense that I do a lot of work with patients that are just purely in health optimization medicine and not using hyperbaric therapy at all. So that's my journey. And I think
Mm.
there's multiple other aspects of this, of course, but that's how I've become the kind of practitioner that I am now.
Yeah, I want to highlight a few pieces. First, the framework foundational piece there
Mm,
that you were talking about that we all need that. And it's kind of the difference between someone who just dabbles in, like, I like actually using financial this analogy of financial interests, like people who just dabble in investments, they are not going to be as successful as someone
hmm
who literally has this foundation of step by step strategy of this is what's going to be the most gains that they can get in that financial strategy. So you use that, we use that with
hmm
medicine. And the what would you say are the biggest differences of the framework that you learned in internal medicine, MD schooling, compared to what you use now?
That's kind of a fun question to unpack. I mean, it's like apples and oranges. There's nothing to compare, right? In the sense that, conventional medicine, what it's really good at is acute care. It's really good at if you have a trauma, like a severe infection, you need a surgery, medicine is really good at that. They're really good at churning out people with acute issues, but they're terrible at dealing with chronic health issues and preventing chronic issues. What it may be able to do is find something early on and treat it earlier rather than treating it later, but that's still a disease focused lens. And what Dr. Ted really was able to do, which resonated with me so much, was like, well, let's not focus on just treating disease. What if we can optimize health? And that was a big framework shift for me. I thought, well, maybe functional medicine is doing this a little bit, and it is to some degree because functional medicine at least is taking it out of band-aid medicine, which is conventional medicine, giving you drugs and supplement, and not supplements, just drugs or surgery and things like that if you have a certain condition. What functional medicine does, which is really great, is takes it, okay, let's look for the root causes of your hypertension or your brain fog or whatever it might be. And I think that's really, really a great step. And what Dr. Ted was able to do that really resonated with me is like, well, that's all important, but what's the foundation of all of this? The foundation of this is actually how your cells are working in real time.
Mm.
And if we look at that from a health optimization lens, that's not only just looking at the root causes of illness. In fact, it's actually the perspective shift, which is how do we keep the cells optimally functioning? How do we optimize vitamins, minerals, nutrients, cofactors? How do you optimize the gut, your neurotransmitters, your hormones, so that your cells can work optimally? And it's also shifting the idea where in conventional medicine, even in functional medicine, oftentimes, not always, but oftentimes, it's more organ based. So, like, it's your heart, it's your liver, it's your kidney, it's your brain. But what's underlying all of that is the universal basic cell. And the shift there is looking at a science called metabolomics. Metabolomics is this really cool science that's been around for about 30 years now. And it's looking at the real times workings of your cell. And it's looking at what's happening, everything from your genetics and all the various ways that your genes get transcribed over time and how that works, but also looking at the environmental exposures that you have, the food, the water, and then the toxins and pollutants that are also in your environment as well. And combining those all together, you can look at this at the metabolomic level and see what's happening in real time. And shifting that network of things that are happening in real time takes practice and takes education, but it's doable. And then you realize once you built this sort of cellular foundation that everything else gets easier. You can't have optimized brain health without optimized cellular health. You can't have optimized liver health without optimized cellular health. So it all goes together. So minding your mitochondria, minding your microbiota, minding your neurotransmitters and hormones, minding the toxins and exposures, and everything else in between. You can actually see many markers on that metabolomic level and use them. So what I often say is that it's not like we're throwing out the baby with the bathwater here. Acute
Mhm.
care medicine, fantastic when it needs to be used. It's great. I use drugs. I mean, for my patients, legal ones, and when it's required, and sometimes illegal ones, but not, if they're doing them in different countries or whatever. But also, I think functional medicine is great, but there's a foundation that it all can be built on, and I think that's where health optimization really stood out for me as a way we could truly move the needle on health, even just a little bit for people and seeing really, really dramatic benefit.
Yeah, what comes to mind when you're talking about this is this video I watched of Dr. Klingart, who is, big in the Lyme world, and he
Mhm.
was talking about how, earlier, I don't know, in the 90s or something, maybe earlier, they were like, oh, it's the root cause of all of these issues is the chronic viral infections that are just
Mm.
keep coming up, right? And then he's like, oh, but then they found out about mold toxins. And they're like, no, it's the mold toxins. And then they found out about Lyme, and then they're like, no, it's Lyme. And so you see when people, come into, and I got into, the work that I do because of my own health issues. But
Mhm.
as a
Mhm.
patient, as a client, you get into this world of natural medicine, alternative medicine. It's a bit like this cyclical issue, and the foundation that you're talking about, that metabolomics,
Mhm.
the cellular energy, that's actually at the foundation. Because if you go after a
Yes.
virus, or if you use medications to treat fungus, that you can get recurring infections, often because the energy of the cell is not able to hold this new state of homeostasis that you're trying to get, which is no infections or activation.
Or at least quelch infections, right? In the sense that, like, I think
Right.
that what it comes down to, and I talk about this with my patients all the time, is I think that there's absolutely utility in a lot of cases to treat the Lyme, to treat the mold. But if the immune system is not optimized, as you just described, Natalie, you're not going to see the potential long-term benefit. And I learned this very early on. And when you try to treat people with Lyme in a hyperbaric chamber, for example, and they would get a little bit better, maybe, but then they would recur. All the symptoms would come back. Even if we try to kill all the bugs using antibiotics or using hyperbaric therapy, if they didn't have a ground game that was foundationally supported. And I think that's the big thing, is that oftentimes we go after the Lyme, we go after the mold, we go after the chronic viral infection, but oftentimes, not all the time, but oftentimes, if you just enhance and optimize immune system function, you recalibrate the gut and make it less inflammatory, you seal up the blood brain barrier, then things get better without actually even addressing the Lyme or the mold or even the EBV and other things directly. Now, that's not always the case, but in clinical practice, I really truly have found this is a very big window into opportunity for people to understand that it's not always, sort of, because people are chasing this stuff all the time, right? Like, my Lyme hasn't gotten away. My Lyme hasn't gotten away. I'm like, I get it, but let's focus on like optimizing that foundation. And then I promise you're going to feel better. And then when you do end up needing to treat the Lyme, if you do, then it's going to be easier to do, right? It's going to be much easier. Your body's going to tolerate it better, and you're going to see the potential long-term benefits.
Awesome. So tell us a little bit more about the metabolomics testing
Mhm.
that you do and what that's actually looking at. So what influences the cellular energy on those, that foundational component, that what do you look
Yeah,
to
sure.
change? What are those levers?
My framework here is it's because I've been involved in hyperbaric medicine for many years. And what happens in a hyperbaric chamber, quick and dirty, is that you get more oxygen in circulation. Okay. More oxygen in circulation sounds good, maybe, right? A lot of oxygen comes in. That's going to help you make more energy, ATP, because oxygen is the final electron acceptor there. However, if your machinery is not really in good shape to make energy effectively or to detox from energy that we make, because now I think most people know that we eat mostly our fat and our carbohydrates to make energy in our cells. That's what it's supposed to be for. And so we have to have all these various steps along the way to shift that food from our micronutrients, from our macronutrients, down into these various intermediates in our mitochondria, and then flip off those electrons from our food and make energy. There's many steps along the way, okay? And for many of us, those steps aren't working very well. And then once those electrons get to our what's called our electron transport chain. There's also many steps along that path that can also be dysfunctional as well. And this is 94% of US adults have some element of mitochondrial dysfunction. It's a big deal. But even when we make ATP, energy, which is our energy currency, it's not free. We don't work like an electric powered car. We're more like a gasoline powered car. We make exhaust. We make what are called waste products of energy metabolism. We make reactive oxygen species. So we make 150 pounds of ATP every single day. It's a huge amount of energy. It gets turned over very quickly. So we're also making a lot of reactive oxygen species. And so in our body, we have to have what are called antioxidants. Most people know those to help neutralize this oxidative stress that occurs, this reactive oxygen species that is happening because of making energy. Okay. And so in my world, initially, I was like, well, I'm putting somebody in a chamber. I'm helping them make more energy. This is going to be awesome. Right. But then all of a sudden, I put them in a chamber and they feel terrible. They feel like they can't move very well the first couple of days, or they feel joint pain or headaches or irritability. I'm like, well, what is going on? Right. And so for me, it was like, okay, this is actually what's happening. They don't have optimized machinery to help them make energy. So one of the main inroads for me into metabolomics was let's look at energy metabolism. Let's look at how people are making energy, how they're breaking down their macronutrients into the small intermediates that are required to help us make energy. And then how we can, because we can measure all of those now using metabolomic testing. I learned about all of these intermediates when I was in medical school. And as soon as I learned about them, I keep saying thumbs up here.
I know.
And I learned about them in medical school, but I didn't know you could do anything about them. All I did was memorize them and then forget about them so I could learn the next thing that I needed to learn. And a fun fact about that is I remember learning about the mitochondria, and like it was just a really, really intense part of my training. It was so much memorization that after I did my test, I went to the ATM machine when you still got money from the ATM machine, and I tried to put in my code and I had forgotten it. Like I had the same code for like 5 years. It was just gone. Like I had just moved everything out of the way. But this is what you did in medical school. You just dumped all this information in your brain and you dumped it out for the next stuff. Like that was just the nature of things. But I've learned over the years that metabolomics is a fantastic way to understand how well your cells are making energy. And you can look at this from the energy input side of things, the macronutrients, the micronutrients, and all the antioxidants that are required to help you make energy, as well as minerals and things. And you can look at it from the output side, like if you're making energy, are you making energy effectively? Are you making it, and do you have a lot of what's called oxidative stress in the system? Are you deficient in antioxidants, for example? And so this became kind of an aha moment for me, really, when I realized that if I could optimize this ground game, foundational biomarkers, looking at metabolomic data, that my patients would do so much better. And the crazy thing about this, Natalie, was it was one of those things where I was like, well, some of my patients don't even need to go into hyperbaric chamber. All they really need to do is optimize their health and focus on that ground game, and then everything else gets better. And it's so like over the years, it's become kind of my smoke screen. These people know me over the years about hyperbaric medicine, although not as much anymore only. But when people come to see me about hyperbaric medicine, I'm like, yeah, sure, we can use hyperbaric therapy for migraines. However, let's talk about this foundational program that I really do feel like could be robust for you and be much more sustainably over the long term. So that's a good example of how I use metabolomic data, but there's a lot of other things that you can look at there. You look at evidence of heavy metal exposure. You look at evidence of toxins in your environment, the food, the water. Look at evidence of your microbiota as well, because you can actually look at various aspects of a panel, of a metabolomics panel, and look at, do you have fungal overgrowth? Do you have bacterial overgrowth? Do you have absorption issues? Do you have digestion issues? And you can then optimize as a result of getting that kind of information. I think the big thing that's challenging for practitioners when they're first starting with metabolomics, Natalie, is that there's a lot of data, and then it's a lot of networked kind of data. So it's not like you want to move just one B vitamin, right? You want to look at the Bs, and you want to look at vitamin C, you want to look at the antioxidants, and you want to look at the intermediates in metabolism and go, oh, like this, because this is happening here, there's another aspect that I need to address here. Or because there's an aspect I need to address here, then we're going to want to address here as well. So it's kind of, it takes a bit of a synthesis of information. So that's why we have a whole training program for people to learn how to bring in metabolomics into their clinical practice. And again, it doesn't take the place really of doing anything else. It's more of like that support, that foundation that can really move the needle. That's what I've seen in my clinical practice.
Yes. So I heard you say there's basically the nutrients and macros, like the macronutrients. There's
Mhm.
the micronutrients as well, the vitamins, minerals. Those are inputs that you can see through this metabolomics test. And then
Mhm.
also you can see the outputs of it, of what's going on in the cell. Like if there's too much oxidative stress, so that antioxidant deficiency, and then the evidence of toxins and the microbiome. And so you can see a lot, and it's kind of like this. I'm imagining like a spider web,
Mm.
right? And when
Mhm.
you know, it's all connected, it's very complex and beautiful and elegant. And then, you know, if you just touch one area of the spider web, it's going to ripple through and affect the whole spider web. So that's a good picture for people. But what type of test is this? Is it a urine test? Is it a blood test? What is it looking at exactly?
Usually it's a combination of both urine and blood. The urine is often, some people have heard of maybe organic acid testing. So organic acid testing is a way to look at metabolomic markers in the urine. And you can use blood testing as well to look at various antioxidants, minerals, and heavy metal exposures as well. It's a combination of both together. And I think one big piece that I didn't mention, I think is also important, is that most of us don't want to be normal for our age. If you're not 21 to 30 years of age, you likely want to be optimized not to be like an average 45-year-old. You want to be optimized to be somebody that could be, you have younger biomarkers. And the most optimal that we are as humans really is between 21 to 30. Although, that's changing in some ways and people are having health issues much younger. But in general, we tend to be the most resilient, the most ability, we have the most ability to be at our best without very little overall, for most of us during that time frame. And so what we do at Health Optimization Medicine at the nonprofit is we train people to optimize their patients and clients biomarkers to between 21 and 30 years of age. And
Mm.
so I don't want to be, I'm 45 years old. I don't want to be optimized for 45. Like, be normal for 40. So I don't want to be normal for 45. I want to have my ranges between 21 and 30. And so you're optimizing nutrient, gut, hormone, neurotransmitter levels to that range is when you're going to feel the best. And so that's why we always talk about longevity versus health span. Longevity medicine, living a long time. Health span is living healthy for as many years as you can. And they don't have to be mutually exclusive here. The term that I like, although it's kind of a cool but interesting term, is called morbidity compression, which is basically you want to live as long as you can for as healthy as you can and then die as fast as possible. And
Hmm.
so you don't have a
Compress.
long time, yes, compress down the time of having disability. We know that everybody's living longer now for the most part, but the amount of morbidity, the amount of disability, especially in women, actually, is actually very, very high and going up. And so the goal is to try to compress that morbidity and then have as much health span as possible. So the goal is to optimize those biomarkers. I have 78 and 80-year-olds that I work with that are optimized between 21 and 30 years of age with their hormones, with their gut. And it's not always easy to find this kind of information, I should mention, because most labs, for example, if you go to a regular lab and get a TSH, a thyroid stimulating hormone done, you're getting an average range, the normal range, between about 8 years old and 90 years old. So it's a huge range. So do you want to have a TSH of 4 if you're 20? Probably not, because that's not optimal for a 20-year-old. You should probably be around 1 or so at your number. So it's important to know if you go to a lab, even for some of the functional labs out there, they're using lab ranges between 18 and 65 and finding a normal range within that. Do you really want to have that kind of range? The answer is probably not. And so we work with one lab, it's called Genova Diagnostics, that Genova does ranges between 21 and 30 years of age. And that's how you get your nutrient, your gut, all that stuff is within that range. And that's why we use them. And then we have our own ranges for hormones that Dr. Ted has created over the years that look at this, 21 to 30 years of age as well. So it's not easy, but normal ranges aren't optimal ranges, is what it comes down to. So even if you're within a normal range, it's not optimal. And this is actually somewhat like freeing for people too, because I know a lot of people out there, they go to their doctor and everything is in the normal range, even though they feel terrible.
Yeah.
This is one of the reasons, right? Is because maybe it's normal for people that are, you know, not optimal, but I
Yeah.
want to be optimal. And
Yeah.
so if I want to be optimal, those ranges may be significantly different.
Yeah, that's the medical gaslighting that so many people end up experiencing, and it's very unfortunate. With the other tests that are out there, I'm curious if you can give your opinion on, Chris Masterjohn has a new saliva
Mhm.
mytome test. It's looking specifically at the mitochondria. But yeah, what are other ways to test this metabolomics issue, and why is it best to use the Genova lab?
I like them because it's probably the most comprehensive, looking at all the various metabolites, the things that are happening in the cell in real time. What you're deferring to, I think, with Chris and a couple other companies out there, is these mito tests, like these mitochondrial function tests. These are some newer tests that have come out in the last 3 to 5 years. Actually, Chris's just came out, I think, early in 2025. And the goal is to really actually understand what's happening in real time with mitochondrial function. So, how well the mitochondria are making energy and detoxing them from it. Chris is probably the most comprehensive out there, although it's new and it's expensive. It's like $700 to do, so it's not a small amount of money for people. I'm intrigued by it. Some of the other ones out there, there's another company, I'm not going to name names, that a lot of people in the functional integrative longevity health span world, like I am, are suspect of at this point, because it's really difficult to get a real time measurement of what's happening in the mitochondria. The way we do it with organic acid testing and metabolite testing in the metabolomics world is pretty good, and I do like it, but it's not looking at things in absolute real time. Actually, looking at the cell and looking at the mitochondria, what's actually happening. There's only like one place in Europe actually that's able to do this, where you send your blood in and it's like not even frozen. It's like fresh blood on a slide. You look at it and they're actually looking at mitochondria. The gold standard way of looking at mitochondrial function is called a punch biopsy. So you actually do a biopsy of the muscle itself, and then you look at the muscle on real time while it's still alive, that cell, or still living, as it were, and then look at what happens, with the electron transport chain and flow and things like that. So right now, the best ways to do it, I think, clinically, are looking at metabolomic testing. I think looking at the some of the additional tests out there that are looking at mitochondrial function directly are interesting, but they're still early and it's not exactly as clinically relevant, because once you find out your mitochondria are XYZ, then what are you going to do about it and how are you going to change it? So I guess ideally, right, you take the test again in like 6 months or a year after you've done some groundwork and done some work. But I still think that you need to do metabolite testing at the same time, so you have a good understanding of what that actually is.
And if it's $800 for a test, it's kind of hard to do more regularly to really see
Right.
that real time response and feedback. So, yeah, I've seen some of my clients who've really improved with their energy. We do a lot of the macronutrient gut microbiome support,
Mhm.
sealing up the blood-brain barrier, things like that. But they sometimes I have a few clients, a handful of clients, I guess, who would get to this point where they just are like, is this really just how I should feel? I still don't feel optimal. And so is that where HBOT and some other components might come into play? So I'm sure I would love to ask some more about the hyperbaric oxygen therapy. But yeah, what do you think is missing for those kinds of people?
I mean, it's so individualized here. Not only, it's so difficult to say, but one big elephant in the room oftentimes is what I call the sympathetic spiral of doom.
I'm
It's
glad you said that.
in patients where their sympathetic activation, their fight or flight nervous system, is just not getting down regulated enough to get into parasympathetic. And parasympathetic is our rest, digest, detoxification, and healing mode. And if you're always in this sort of sympathetic overdrive, and this is very common, okay, we have a culture that applauds sleeping when you're dead. Or in medical school, I had shirts with my friends that said sleep is for quitters. And so it's just part of that culture. I grew up in New York. Yeah, my father is actually one of those like 1 to 2% of people that can live optimally on 4 to 5 hours of sleep a night. And so I just saw him like going to work in 4 o'clock in the morning and working until 8 o'clock at night, and then going, then having the same thing and just doing it again every day. So I just thought that was normal, right? And I didn't know that there was this thing called I mean, I kind of knew, but like I knew that, like a lot of people that are type A, it's like, well, I just got to go, more and more and more. And then this translates into people that have chronic complex medical illness, because they're looking for the next thing that's going to help them, looking for the next thing that's going to fix their disease and treat their disease and cure their disease and all these kinds of things. And it becomes a sort of like this self-perpetuating spiral, this sympathetic activation that also releases more neurotransmitters that really force your system to make more energy or try to. And then the mitochondria, that part of your cell that we were talking about, become less optimal. They kind of flip into this hibernation cell danger response mode, which is where they make less energy. And then there's this sympathetic compensation for having less energy around. And like this becomes this huge thing. And so the main thing that I really do try to address, or at least understand with my patients when I first see them, Natalie, is like, is my method of typically working with them going to be optimal for them? Or is it requiring that we truly address some of the sympathetic activation? I just got an email today actually from I just saw a new patient couple, and I had a good conversation with the husband yesterday, but he sent me an email. He's like, you know what? I don't think my wife's ready for this. Like she's got a lot, she's got a divorce that's like one of her daughters and like a lot of stress. And I'm like, yeah, like we don't want to have, like, I'm not going to start trying to change her diet with everything. I'm not going to try to give her 10 supplements right now. We got to work on that sympathetic activation first, or else nothing that I give you or her is going to work. And like, I've been burned like this over the years, and I felt terrible. Like, why didn't hyperbaric therapy work? Why didn't this supplement regimen work for this person? And it's because that sympathetic activation was so extensive that when you're clamped down like that, nothing's going to work. And I've seen this time and time again. And most people, when I first have this kind of conversation, I have to be very careful about it, right? Because I'm not trying to tell you that it's all in your head, but I am trying to tell you that it's all in your head. Like in the same time, in the sense that like, that's the way we're going to address it. But you have full systemic symptoms. You have GI issues. Like you can't digest your food. You have diarrhea every day. Yeah, I get it. But we have to address that sympathetic activation. No matter how many supplements I give you to address your gut dysbiosis or whatever, it's not going to be very helpful, or at least not long term. And it's a nuanced conversation because, like, I know, and I'm sure you have these same kinds of ideas when you're working with people, Natalie. It's like I can tell very quickly within the first 5 minutes max if I'm going to be able to really address this from my typical framework, or if it's going to be like, no, we need to start a lot slower and then work on addressing some of these other things first before we get there. So I think that's one of the major, like one of the major elephant in the room, right? Is if there's super sympathetic activation and they don't know how to get it out of fight or flight, then they're not going to heal.
Mm-hmm,
And then
mm-hmm.
from there, there's multiple other things, and I can certainly talk about, hyperbaric therapy. And like when people get stuck, I think if it's not that sympathetic activation, then it could be any number of other things. But then I have a whole armamentarium of things that I think about here. I think about methylene blue, which I know we'll talk about. I think about hyperbaric therapy. I think about how am I going to support them in a sort of more maybe circumspect way. It's not going to be the direct way that I typically would do it. But these are things that you get to be more understanding as you get further in clinical practice, because it's very difficult to have a cookie cutter approach. It can work for maybe like 20 or 30% of your patients, but for everybody else, it's going to be, the art of understanding how to navigate.
Yeah. Yeah. So what I'm hearing are in that state of sympathetic dominance for people, we have to address that. You're talking about that. You are saying, hey, there's the it's in your head, but it's very physical for people, of
Yeah.
course.
Yeah.
So then you've talked about there's the short-term kind of band-aid approaches that are
Mhm.
actually not just the band-aids, like they have very, very effective healing potential, like the
Mhm.
methylene blue. And then there's the more long-term therapies that you really want it to be lasting for somebody. And for it to be lasting, the better the state of your body is in that parasympathetic,
Mm.
receptive, open, calm, confident, capable state, you're going to be more receptive to whatever treatment or therapy it is. So
Yeah.
getting that nervous system down regulated.
Yeah.
What do you like to recommend people to do that? Is it
Mm.
somatic therapy? Do you have people do limbic work? We've talked about some of these things on our podcast before, but what are your favorites to recommend people?
So I love so many different frameworks for this because there are so many different ways in for people. There's everything from limbic training to cognitive behavioral therapy, somatic work, EMDR therapy, psychedelic therapy. There's lots of different ways in, okay? And a lot of it just depends on the person and kind of what is causing the stress. Is it a toxic relationship? Is it a toxic uh, job that they have? Is it a challenge with trauma than they had as a child that they never feel safe? Is it
Mhm.
something more? There's so many different things it can be. The key to is understanding the why and then finding the best way for that person to start that road of healing and or downregulation of the nervous system. The challenge with all of that, though, is it can take time. It's not easy to downregulate your nervous system. But so what I typically do here is understand the why of the sympathetic overload as best I can. And then we start addressing this from a psychosocial emotional aspect of things. Where can they best find and navigate there? But how can you get them to feel what it feels like to not be in sympathetic overload? There's a couple really interesting ways to do this. There is the supplement way, and then there is the personal practice way. And everybody is going to be different depending on kind of what they feel most aligned with. But the neurotransmitter that I go back to over and over again here for my patients is the GABA neurotransmitter. So GABA is gamma aminobutyric acid. It's our primary inhibitory neurotransmitter in the brain. It's the brakes of our brain. So your gas pedal is actually glutamate, although people don't know glutamate very often. It's our primary excitatory neurotransmitter. So is norepinephrine, dopamine, and serotonin. Serotonin not as much, but definitely dopamine and norepinephrine. These are kind of our accelerator neurotransmitters. And glutamate and GABA are actually in balance in the brain. So glutamate actually gets converted into GABA in the brain. And then in total, with just those two neurotransmitters, that's 80% of your brain's neurotransmission. So we always hear about norepinephrine and dopamine and serotonin, but it's only a very small minority of what's actually happening in the brain. And unfortunately, many of us are GABA deficient, meaning that our GABA levels are too low, our glutamate levels are too high. So we get sort of stuck in this, again, this fight or flight, excitotoxic kind of pattern. And the problem with GABA deficiency, what is it associated with? Anxiety, depression, insomnia, mental health disorders otherwise, tremors, irritability. And so if you go to your doctor and say, I'm feeling anxious, are you going to get something that enhances the GABA system? No, most likely. Well, maybe you'll get a benzodiazepine, a benzo like Ativan, Xanax, and Valium, but these come with a significant potential of risk, and we can talk about that. But what I'm sort of driving at here is that most clinicians aren't thinking about GABA deficiency. And we know that depression, for example, is not a serotonin deficiency. We know now from the last several years that when I was in medical school, I learned that depression was a serotonin deficiency. And that's why we needed to give drugs that increase serotonin to help treat it. But we now know that people with depression have no difference in their serotonin levels compared to people that don't have depression. And so we're artificially increasing the serotonin. It does help some people, but it takes 4, 6, 8 weeks to be able to do that, if it does at all. And then there's also the black box warning that happens that you have on these drugs because they increase suicidality in especially younger people. And I actually know the lady who started a nonprofit because her sister killed herself after starting an
Mhm.
SSRI, and nobody knew about this potential risk back in the 1990s. And so we know that serotonin deficiency is not an issue, but there's actually significant data that say GABA deficiency is significantly associated with depression, actually. And so the main thing to think about here is your mind. Your thoughts, you have a lot of them every single day. On average, we have about 70,000 of those every single day. And then if you're anxious and you're depressed, this is going to go up to about 120,000 thoughts or more. This is your mind not thinking 120,000 separate thoughts. It's 120,000 similar thoughts over and over and over again. And your GABA system helps regulate all that. Okay. And so if you can enhance and support the GABA system very quickly, you're going to start feeling like your mind is going to be quieter and your nervous system is going to be able to calm down. And if you can give your patients and your clients an experience of feeling calm, then they know where there is. And so that they start doing some breath work, they start doing some yoga, they start doing some mindfulness training. And then all of a sudden, like, oh, this is what it felt like when I actually enhanced my GABA system using maybe supplementation. But the other note to make here is that GABA itself you can get it in a supplement form, but GABA is too big to get across into the brain as a molecule. It's just too big, unless you have a blood-brain barrier that's allowing things in that shouldn't get in there. We call that a leaky brain. It sounds scary, but it's very common, especially in people that have leaky guts. Like if you have a leaky gut, you often have a leaky blood-brain barrier too, allowing things in. And I've had patients that I work with over the years where GABA supplements are working great. They feel calm. Then we seal up their gut and the GABA supplements stop working. Okay. So that's diagnostic. And I've actually heard this from a number of my colleagues over the years. And so don't be worried. Just know that there's something to be addressed here that's causing those GABA supplements to work for you. And so I think about enhancing the GABA system in different ways, using different supplements that will help bind to the GABA receptor, but in a more holistic way. You don't want to run to alcohol. Of course, alcohol binds the GABA system. You don't want to run to benzos, Ativan, Xanax, and things like that. You don't want to run to your sleep drugs, your Ambiens of the world, because what happens is that they bind to the GABA receptor super tightly and they deplete GABA in the process, and they give you this risk of tolerance, you needing more of the same drug over time to get the same effect, dependence, where if you stop it, you get withdrawal symptoms. And, with benzos and with alcohol, you can die if you stop it too quickly and don't have, the support on the GABA receptor to prevent that from happening. So I like various plants and herbs and mushroom derivatives to work on the GABA system, which we can talk about if you have interest. But I just want to give you that framework at least. So
Oh, that's so helpful because I love just you set it up that most of our neurotransmitters are this glutamate and GABA. So why is it that we are so focused on serotonin to help someone with depression when we could really just help them with GABA? Because we just need more GABA. So I love that approach, and there are so many. It is really great to use GABA for a period of time, especially most people have first coming to you that leaky gut, it's going to work.
Yeah.
But if it doesn't work for them, then that's great. That's also diagnostic, right?
Yeah,
And
it can be. Yeah.
yeah. And so I guess the takeaway here is to really activating more calm in that GABA receptor. And there are some interesting, I thought of some probiotics that are
Yeah.
supportive for this, like bifidolongum.
Mm.
And so many of my stool tests, I like to use the BioMFX stool
Sure.
test, and that one comes up very low for so many of my clients. But you can see the function of the GABA increasing when you start using that. But yeah, I just love getting people to do the lifestyle pieces
Of
first. Like
course. Yeah.
don't overload people with a ton of supplements right
Of
off the
course.
bat.
Yeah. Yeah.
Maybe one supplement, is like really going to give them a little bit more wiggle room to start to find the lifestyle pieces that are really going to carry them through
Yeah.
with
It's just
that.
harder to get started sometimes, right? And then because
Yes.
there's so much that you feel overwhelmed and like, how can I deal with? I remember I was just maybe a couple months ago, I had a conversation with somebody. It classically starts with me talking about something very random or different. And then we get to the point where like she has significant amounts of anxiety. She's had this since she was in her 20s. She had severe loss of her father, like very quickly over a couple days, and she just hasn't been the same. But she didn't realize that until this conversation. And I was like, okay, you want to feel better. You want to work with me, but we have to look at this sympathetic fight or flight aspect and how you're going to address it. So I gave her some resources. She was super like grateful for them, but she's like, well, how can I feel better now? And I'm like, well, it's going to take time with that stuff, right? You have to find the right therapist, the right ecosystem that you feel comfortable in.
Yeah.
So you mention probiotics, the lactobacillus and bifidobacterium. These are two types of probiotics, two types of bacteria that are very well known to modulate the vagus nerve. The vagus nerve is our primary winding nerve out of the brain that works on that parasympathetic tone. And so it doesn't increase GABA directly, but it does modulate the GABA system in the brain to help get more capacity for you to use the GABA system. And then, so I like that. I use some kava. I use CBD and CBG, which are non-psychoactive cannabinoids. The non-psychoactive cannabinoids are nice because they also work on the endocannabinoid system in our brain, which is this balancing homeostatic system. That's what CBD and CBG and THC, they were all found and discovered. They discovered when the people use those from the plant itself, the cannabis plant, that it was modulating the system in the brain.
Mm.
And I also use this really cool compound that's called agarine. Agarine is from a psychedelic mushroom called the flyagaric amanita mushroom. Many
Ah,
of your listeners may have heard about it. You can get these amanita extracts right now. And the cool thing about amanita is that it is a psychedelic mushroom, and it has some neurotoxic ingredients in there. So you have to be a little bit careful. It has to be dried. And then I use something called agarine in there, which is a long-acting molecule or compound that gets to the blood-brain barrier no problem and binds to where GABA would bind on the receptor. And it lasts for about 6.5, 7 hours as a half-life. So it's really nice for sleep for people, because sleep, you need more GABA around to sleep through the night. And people think about melatonin for sleep. Melatonin is one of like 5 or 6 neurotransmitters that are very important for sleep. There's melatonin, there's adenosine, there's serotonin, there's GABA, and there's the endocannabinoid system as well. At least 5 neurotransmitter systems that I try to address when I help people with sleep, for example. So, and then again, you give them the experience of calming down the nervous system, and then you give them breath work, you give them other things that they could do along the way while they're doing the harder work of really trying to understand why their nervous system is in fight or flight. Is it divorcing a partner? Is it sleeping in a different room than your partner? That's a big one. Or the big thing that I've actually just been learning about is just getting a separate duvet, getting a separate cover, like
yes.
just having a separate one from your partner, like can go and like save marriages.
Yeah,
And so like,
that's the
you've
Swedish
heard about this.
sleeping method. Yes,
You've heard
it
this?
helped. Yes, I have.
Yeah.
It's awesome to
Yeah.
just keep people's body temperatures regulating themselves instead of
Or then have to
overheating.
share covers. Like you have like your own covers, right? So like
Yes.
you have your own blanket, you're sleeping next to your partner who has their own blanket. And so you're not like, trying to like
Yeah.
fight over covers. Like in my bed, like I'm like in one corner. My wife takes up the rest of the bed,
Mhm.
but like I'm in that one corner. I don't move, and she does whatever she wants. I don't feel anything, especially because if you have a separate blanket as well. So
Mhm.
I mean, sleep
Mhm.
divorce is the other name for this, right? There's also, I think there's like a more positive spin on this. It's like sleep union or something, but sleeping in a separate bed can save marriages and save your stress levels. They've actually done studies on this. If you have a snoring partner, even if you think you fall asleep throughout the night and you fall asleep, if you wear like some sort of tracker, you will see that you're getting up much more than you realize. And it's disturbing your sleep. So don't be afraid to take care of yourself. That's what I always tell my patients. It's like, don't be afraid to really optimize your health, because if you can optimize your health, everybody else is going to have a better experience around you. And this is the classic caretaker role where we're all trying to take care of everybody else and forgetting to take care of ourselves. And if you have children, which I do, it becomes immediately obvious that if you're not taking care of yourself, you're just not as good of a parent, just in general. Like you're more reactive, like you're just not going to be as, as optimal as you could be. And then
Mhm.
I think when you have kids like I have over the years, it becomes immediately obvious. If somebody's saying something and I yell at them, I'm like, whoa, where did that come from? Oh, because I have a headache, or oh, because I'm tired, right? Because
Yes.
that
Yeah.
observation, those observational skills become less, you have less capacity of those if you're not taking care of yourself. So
Mhm.
if there's another vote for optimizing your own health, I think that is.
Mhm. One last question about the neurotransmitters. I'm curious
Yeah.
about that GABA glutamate system and how that might relate to like the overstimulation of dopamine that we have um, in our society. How does GABA relate,
Mm.
supporting GABA relate to dopamine?
Yeah, great question. And it's actually one that I've never been asked, which so I love. It's like the cool thing about GABA is that it's called an interneuron, INTER. So that means it kind of sticks itself where GABA neurons kind of stick themselves in between other neurons and regulate the flow of information. Okay, so if you are thinking about regulating flow from a dopaminergic neuron, GABA is helping you regulate that flow. So if you're GABA deficient, you're going to have less capacity to regulate that flow from dopaminergic neurons. And you're going to have more overstimulation, more dopamine around than maybe should be, or maybe giving signals that really would be more regulated if there was more GABA around. And
Mm.
so, yes, dopamine fasting is important, right? Taking yourself off of social media, off your phones, and stop doom scrolling. In addition, the GABA system regulating that, it's like going to regulate your capacity to be able to actually stop yourself from doom scrolling, and actually being able to take yourself off of these things because you have more of a governor on the wheel. The way I think about GABA sometimes in another but related way is that if you looked around your room right now or wherever you are listening to this, there is a huge amount of information that could be potentially come conscious to you if you chose to, but your brain is only giving you what's required so that you can actually process what's happening. Driving is a great example of this, right? And so what GABA is doing is helping regulate all of that flow so that you're not overwhelmed by all that information.
Mm-hmm.
If you didn't have enough GABA around, which if you don't, you can be overwhelmed very easily. And this is a very
Ah,
common thing. If you go into a room and feel overwhelmed very quickly, you're not having a lot of regulation of that GABA system. You have GABA neurons in the brain, you have them in the spinal cord, you have them in all areas of the brain. Okay. And so it's this interneuron, this sort of master of all, that is the unsung hero that's regulating brain function at all times.
yeah. Oh my gosh. That makes me think about several clients who will respond to the things that I give them with just this sheer, like just constant overwhelm. And, I give people little pieces as
Hmm.
much as possible, and anything new is going to be overwhelming, I think, for most people, and especially in our society. But
Yeah.
that's a beautiful, that person just needs more GABA. How amazing. Because I think of it like a moderator, right? Like
Yeah.
someone
Mhm.
who's just saying, yes, you come in. No, like we're just gonna pause here, slow this down. And with all the other neurotransmitters, that's what's happening in your brain.
That's a great
So
way. I think I might use that if you don't mind. I like the
yeah,
moderator, and because it's
yeah.
a great way to think about it. So it's sort of like a waylay station to be able to understand and calculate what you actually need versus what you actually don't need, right?
Mhm.
And so it's a pit stop, but it's an important one to regulate flow of information, both
That's
up and down, right? So into the brain and
yes.
out of the brain too.
Awesome. Thank you so much. So I want to quickly go back to hyperbaric oxygen therapy just
Sure.
because I want to talk about my own experience with it.
Hmm.
I moved to Colorado, and actually because of the high altitude, like some more autoimmune symptoms popped up for me.
Mm.
And then I learned about hyperbaric oxygen therapy and I did it, but I actually did it in I only did a few sessions. I the cost was a bit prohibitive for me at the time.
Hmm.
So, and then I did it in a soft shell, which I then later on learned at a conference that that's really not dangerous, but it's not the best for, um, because of the types of bacteria that it can't like stay at the pressure that
We
it
can talk about
needs.
it. Depends. Yeah. So it depends on the
Okay.
indication. Yeah. Yeah. Yeah.
Awesome. Well,
Yeah.
can you get into that? Tell us about the difference of what to look for if someone wants to do HBOT, and when it should be used. I guess also how many sessions are needed. Kind of
Sure.
the full sales pitch.
So the sales pitch, well, I could talk about my framework, right? The framework, which is that I've been involved in hyperbaric medicine for a long time now. And what it comes down to is that the first sort of fork in the road usually is this an acute issue, or is this something that's been going on for a while? Or is it a long-term goal that you have? So that's the first fork. If you have an acute issue, hyperbaric therapy is often fantastic because it's going to increase your body's capacity to heal faster. It decreases inflammation, stem cell release, it fights infection, improves immune system function, increases lymphatic flow, and it decreases swelling. So all of that is great. So if you have an acute issue, acute fill in the blank, it could be anything from like an emergency, like going to the hospital from one of your limbs is hanging off because it's almost amputated, and I've seen this, or it could be something that had like you had an ACL tear, or you had a musculoskeletal injury. Hyperbaric therapy is going to help very, very quickly just rev up the whole body's capacity to make energy and efficiently heal. Okay. And then, of course, my framework doesn't just include hyperbaric therapy, it includes what I like to call euphemistically my educationally throwing shit at the wall strategy, which is that if you come in and you have an acute issue, we're going to give you a comprehensive plan as much as we can and get you better as fast as we can, because we know that from an acute perspective, it's much easier to heal stuff when it's acute versus when it's chronic. And so if you have an acute issue, hyperbaric therapy can be very fantastic here. And then you want to think about what the right pressure might be in the chamber and how many sessions. I'll get to the pressures in a minute, but the sessions aspect is the important part here, where typically for an acute issue, you don't need that many hyperbaric sessions to see a significant benefit. Whereas if you have more of a chronic issue, it's going to take significantly longer. And so that's the other bucket. So the smaller bucket, like the 5 to 10% of people that I've seen over the years, maybe even less, maybe 5% at most, is going to be the acute issue, right? You have an acute issue, you go into hyperbaric chamber, we educationally throw shit at the wall, and you get better, often, very, very well. On the other side of things, which is the chronic bucket, this is the people that have chronic complex medical illness or long-term issues. Say you have mild cognitive impairment, say you have a chronic infection, say you have chronic pain, a lot of other things that could be in here, and you have ADHD, or you have there's about a billion things I could potentially mention. This is all chronic, right? This is stuff that didn't happen overnight. And so the system, your whole body your cells specifically need more of a stimulus with hyperbaric therapy to get better. So you're usually talking about protocols of 20, 40, sometimes 60 hyperbaric sessions to see a significant benefit here. And these treatments are typically done Monday through Friday with the weekends off for that period of time. So 5 sessions a week, 2 sessions off, sometimes 6 sessions a week, sometimes up to 12 sessions per week, actually even twice daily, depending on the situation. But in essence, what we're doing here is that we're looking at the epigenetic shifts, the shifts in expression of various genes that happen with long-term cumulative exposure of hyperbaric therapy. But what you've already been hearing me talk about a lot is the opposite of educationally throwing shit at the wall, is that educationally throwing optimization at the patient and optimizing cellular markers, biofoundational markers, so they can make energy effectively, they can detox well, they have optimized gut, hormones, neurotransmitters. This is really important because if you're not doing all of these things, at least to some degree, for the majority of people that I see, you're not going to see the long-term benefit of using a hyperbaric protocol. Not all the time, but oftentimes this is what I see, is that people are not well optimized, so they can't make energy effectively. So if I'm putting them in a hyperbaric chamber, they may see some benefit, but they're not going to see the optimal benefit. So I usually like to wait 3 or 6 months before recommending hyperbaric therapy in this more chronic bucket so they can get more of an optimized foundation underneath them. And that's where laboratory testing and supplementation and dietary changes and other practitioners that might be helpful. And then understanding all this in an ecosystem. And then sometimes I don't even need hyperbaric therapy, as I said earlier, right? Sometimes you don't even need to go into the chamber because you've optimized everything else. You're like, oh, well, I feel good. I'm like, well, cool. Now you can still use hyperbaric therapy for other more acute things, but you don't need it for this chronic thing anymore, which is super interesting.
That's
and
awesome.
From a pressure perspective, just to kind of answer that, is that the milder pressures in the chamber are usually more for neurocognitive optimization, whereas the deeper pressures in the chamber are typically more for systemic healing and infection. And so we have our nomenclature, we talk about feet of seawater because we pressurize a hyperbaric chamber to simulate the pressure you'd feel under a certain amount of seawater. So about 15 to 25 feet is more neurologic pressures and neurocognitive optimization, and 25 to 45 feet is our major range for systemic optimization. Of course, there's going to be spectrum here, and it's not going to be everybody's going to fit in these buckets all the time. But those milder pressures can often be done in a soft type of chamber. But I don't usually treat infections in soft chambers. And so if you have a neurocognitive issue, if you've had a concussion, a brain injury, a stroke, more neurologic kinds of presentations, you can use the soft chambers and see fantastic benefit. But if you have more of a chronic issue where there's more infection, more systemic related, then oftentimes going to a deeper pressure is going to be much more therapeutic and powerful. And because there's a theoretical risk for some bugs that, like oxygen, for example, that if you give them a little bit of oxygen, they might grow a little bit more. But if you give them a lot of oxygen, you're causing too much stress in the system for it to be an issue with more growth. But there's more nuances to that. But in short, mild pressures, not typically for infection. And it sounds like that was your experience, right? So,
Well, it was just told to me in hindsight at a conference, and this person was selling hard
of course,
shell.
yeah.
Yeah. So, I love your framework. I think it makes a lot more sense. It's a pattern. It's a common theme we see in our podcast when we interview people who have systems thinking, that there's really nuance to and specific instances where these different types of the same treatment could be utilized. And one of the I guess situations that I want to ask about is because we had your friend, Dr. Nasha Winters on
Mm-hmm.
and talking about cancer therapy. And I've
Mm-hmm.
heard of using HBOT for cancer treatment. And she kind of mentioned just briefly about using it at a specific time.
Mm-hmm.
And can you get into that a little bit of what you would recommend generally? Because I'm sure there's a lot of
Right.
nuance and specific
Yeah.
individualization here.
Yeah, I love Nisha. She's been a good friend for many years. Actually, we gave a talk at a conference. She'd already been doing talks, but it was actually my first big hyperbaric talk back in like 2017, I think, in Kansas. And so
Oh,
it was cool. It was really cool, and she's a really cool lady. And we talk about hyperbaric therapy a lot in the context of cancer, obviously because that's what she specializes in. And what it comes down to is that there's about 7 or 8 different ways to use hyperbaric therapy in cancer, but they all benefit from her perspective and mine, which is very similar, which is metabolic health is primary. Okay. And if
mm,
you don't have optimized metabolic health, everything else becomes more challenging to see major benefit. And in fact, another funny story maybe is that I was disinvited to speak at a hyperbaric conference during the pandemic. So it was a virtual conference because the title of my talk was going to be "Please do not put them in the chamber." Not really good for the bottom line for people that own hyperbaric chambers or companies that are selling hyperbaric chambers to the community. But it was a tongue-in-cheek way of saying that not everybody's going to benefit from going to a hyperbaric chamber right now. It's not an if thing; it's a when thing. I think anybody at some point in their life is going to benefit from using a chamber, but it may not be now. And then when it comes to an oncologic diagnosis, there's a lot of nuances in here, as you can imagine.
mm,
And so the way we're just kind of rattle them off as a list, we're using hyperbaric therapy as a way to chemosensitize and radiation sensitize tumors. That's pretty well described. We're using hyperbaric therapy to heal from injuries that occur from radiation exposure. That's actually an FDA insurance approved way of using hyperbaric therapy. So not acute radiation injury, but chronic ones that pop up, years or decades later in radiation areas. So that's actually covered by medical insurance. We're also using it as a palliative treatment for people to just feel better because it's going to give you more oxygen and more energy. So if you're low blood counts and you're fatigued all the time, not that awesome, right? And so hyperbaric therapy can be used that way. It also can be used as a recovery from surgeries that are around oncologic diagnosis. It could be recover from any type of surgery, really. We have pre-post hyperbaric protocols that can get you better faster, about 50% of the way, typically 50% faster, so not a small amount of recovery time.
mm.
And then we also are using it in sort of the bigger bucket, which is in Nasha's world, with in addition of other oxidative therapies and combining it with things like the ketogenic diet and other oxidative therapies associated with this, even IV methylene blue is being used in this way actually, and others in combination for like what's been called the press pulse technique in various ways, but that's just pressing things with the ketogenic diet and pulsing with other oxidative therapies, including deeper pressure hyperbaric therapy.
Mm.
So the context of here is very important, though, right? Because if somebody comes in and says, I want to use hyperbaric therapy for cancer, it's like, well, where do you exactly fit into that framework that I just mentioned? And then what are the best kinds of protocols are going to depend on kind of where they are in their journey and what else they're doing.
Awesome. Yeah. Tell us about methylene blue then. What is
Okay.
it and how does it work?
So methylene blue is one of these very interesting compounds because it's been around for a long, long time. It was made in the 1870s, not 1970s, 1870s. And it was made as a textile dye at that time to dye things blue. And it did it very well. If you got a pair of Levi Strauss back in the 1880s, it was likely dyed with methylene blue to turn them blue. And at that time, there were no antimicrobials around. If you had an infection, if your body didn't do something to wall it off, you were going to die from it. And interestingly enough, methylene blue, there was a very significant push at that time to look for any compound at all that would help with infection. And they found out that methylene blue is a fantastic one because you can use methylene blue at high doses and kill pathogens, including malaria, which was the first approved use of methylene blue back in 1897 with our early FDA at the time. But it would kill pathogens, but it wouldn't harm the human cell, the human host.
Wow.
And that was very uncommon. And it was called a magic bullet at that time for that reason. And so between 1897 and the 1950s, before antimicrobials came around, it was one of the primary antimicrobials available for fungal infections, bacterial infections, as antiviral, urinary tract infections, and of course, malaria.
And when you say antimicrobials came around, are you talking about antibiotics?
Yes,
Okay.
antibiotics. So,
Hmm.
like penicillin, for example. So, penicillin was invented or discovered really in the 1940s, but it didn't become something that was being used in a mass market way until after World War II. And so, during World War II, you were traveling with methylene blue, especially if you're going to the Pacific, if you're going near Japan, and you're going to be in some of the jungles and some of the islands over there. And so they had songs about peeing blue in the loo, because the loo, of course, is UK speak for the bathroom. And so when you take methylene blue, it concentrates and it gets excreted in your urine. And so your urine can turn blue along the way. So, fun fact, if you're going to take methylene blue, your urine's going to turn blue. So, don't be scared. That's just what happens when you take methylene blue. And in the 1950s, when penicillin and other antibiotics came around, methylene blue became less interesting to people because we all love the new thing, right? But we still know it's a fantastic antimicrobial. And even now it's becoming more prominently again in the world of integrative medicine as an antimicrobial, as something that can address Lyme and Bartonella and mold and fungal and other fungal infections, as well as viral infections too. Because higher doses of methylene blue, around what I would say is about a milligram per kilogram, which is around 70 milligrams, 50 to 70 milligrams for the average human, average adult. It's fantastically antimicrobial because it makes hydrogen peroxide in the system.
Mm.
Hydrogen peroxide, we know we can buy at the store, but our cells actually make hydrogen peroxide as an anti-infective, as an anti-cancer, as just a sort of immune system enhancer in general in the body. And then when hydrogen peroxide gets produced, it increases the production of antioxidants in the body, like glutathione, which is like your master antioxidant. That is, if you can make it on your own. And that's kind of a problem sometimes if you're starting with too high a dose of methylene blue. But the other history of it is that it was also found out in the 1950s and 60s that it had capacity to increase norepinephrine, dopamine, and serotonin, three neurotransmitters, because it works as a monoamine oxidase inhibitor. So it basically prevents the breakdown of those neurotransmitters. So the first antipsychotic drugs were actually derived from methylene blue. And from there, it had this really interesting history where it started becoming more involved in chemistry. And what they found was that methylene blue would concentrate in the mitochondria, the part of our cells that make energy. And as a result of that, well, what is happening in the mitochondria? Why is the methylene blue going there? And they realized that methylene blue had this fantastic capacity to support mitochondrial function, to actually compensate for mitochondrial dysfunction, both on the energy production side and on the detoxification side. It has this really cool capacity to do what's called redox cycling. All that means is that it can help you make energy. And then we talked about how energy production is not free. In methylene blue's case, especially low doses, it is kind of, because this low dose not only helps you make energy, but helps you detox at the same time. It helps bind up those free radicals that are being made from energy. So that's why methylene blue, especially at low doses, like 4, 8, 15, 16 milligrams, is like an electric car, not a gasoline powered car. And so that's important because that's why I seem to have, and I've had a track record now using it for over 5 years, where you can use it very early on in patients, in people that are having significant mitochondrial stress, and then slowly increase the dose while you're doing the other things that are going to take longer to optimize their health. We talked about the GABA system earlier. We talked about how it takes a while to find sometimes the ways to downregulate the nervous system. But short term, we can optimize GABA. We can do things to help there. And just the same thing with the mitochondria. You can optimize the mitochondria now a little bit while you're doing the harder work of optimizing it over the long term, which can take 4, 6 months or longer in some people.
Yeah. So I can imagine if someone has, dirty, a lot of garbage in the cell from,
Mm-hmm.
carb burning their whole life. Maybe they have had lived in a moldy home. So they have mycotoxins that are built up in the cell. So as they're getting about to work on those things, getting those out of the cell, maybe taking smaller doses of methylene blue would help burn cleaner energy so there's not as
Yeah.
much buildup of garbage in the cell, right?
Yeah. I have a
For
great story there, just as an example. A lady She was a physical therapist. She is a physical therapist, but she'd been out of work for a couple of years. She had significant mold exposure in her home. She had mold in her body, and she got the mold remediated in her house. She got the mold remediated in her body, but she still felt like crap, and started some methylene blue. Within a couple of weeks, she was back to work. It was like night and day because her mitochondria just needed more support. And it wasn't the only thing that she'd been doing. She'd been doing a lot of other things for a while, but nothing really seemed to be moving the needle until she started some methylene blue at the same time. And I think that's just an example of what you're just describing there. With once you start cleaning up the garbage, once you start optimizing energy production, then the cell's like, okay, now I can really do some additional work here, and I actually can leverage some of the other things that you're taking to make them work even, make my cells even work even better.
Awesome. So does it bioaccumulate in your body? Is there a risk to taking methylene blue for a long period of time?
Mm,
It is a chemical, right? So I've never been one to bar my clients from using something that's like, been
sure.
researched. Obviously, there's a lot of research behind this, but from my own bias of
Yeah,
being a bit granola crunchy,
I
um,
get it. Yeah,
I've always been one to be like, oh no, I want something natural, right?
yeah, yeah.
And then personally, I've actually had seen some clients who have taken it, and then they crashed after a while, and it was usually a treatment of higher doses for
Right.
Lyme or chronic
Sure.
fatigue. So can you, yeah, that was a
Yeah.
lot of questions.
No, I can navigate it. It's cool. I think that the main one that you sort of started off with there, which I appreciate, you being, honest about it is our biases, right? We all have these, right? And it's very common in the alternative world, especially that I grew up in, by the way. And I didn't have anything that wasn't from the ground until I was like 14 or something like that. And so my father was like militantly natural for a long time. But over the years, he knows that medical interventions are necessary sometimes. Like he won't just have, a mom call with a baby that has 105 fever and say, put them on ice and call me in the morning. That's what he used to do. Okay. But he now knows that it's important to have a medical establishment so that you can use these things tactically when you need them. Okay. And that's how I kind of think about methylene blue, right? We don't live in a fully natural world. No matter what we
Mm-mm.
try, you're not going to be under perfect lighting all the time. You're not going to have perfect food, mineral infused water, sunlight, grounding, stress levels that are always awesome, right? And so we don't live in a natural world. Just don't. And so sometimes we're going to need synthetic things to help us. So if you have a bad infection, I hope you never do, right? But then you have to go to the hospital and get antibiotics. You're going to do that because it's going to save your life, right? And it's the same kind of deal here with methylene blue, right? We don't live in a natural world. We live in a synthetic world, and it's a synthetic compound. It's made in a lab. That is absolutely true. That can help us compensate for living a synthetic world. And as a result of that synthetic world, this synthetic compound can be very, very helpful some of the time. Not all the time for everybody. And I think we can talk about that as far as dosing and you mentioned the things that you mentioned earlier, and I'll address that in a minute. The counterpoint to this, which I think is also important, is that not everything natural is good for us. Okay. I've seen people forage for the wrong mushrooms and die of liver failure, terrible deaths in the ICU. Okay. And so this is just a counterpoint that nature is trying to protect itself from other things. And
Mhm.
mushrooms just happen to be one of those things that protect themselves at a much higher, what's it called? Lethal level than other kinds of things. And so as a result of this, the dose is always important here. The dose we talk about in medicine, the dose makes the dose makes the therapeutic benefit, the dose makes the poison. And this is for natural compounds as much it is as it is for synthetic compounds as well. So I tend to be one of those people where I will want to go natural first, no doubt about it. But knowing that there are roles for things that may not be natural depending on where people are in their evolution, right? And this is what it comes down to when we talk about dosing. Methylene blue dosing is extremely important. What often happens, especially if people are on very high doses of methylene blue, a milligram per kilogram or higher, these are great anti-infective doses. But these are also stressful to the system because the body's killing organisms by making hydrogen peroxide. And then as a result of that, you're increasing the need of your body to make more antioxidants. And so if you're using a lot of methylene blue at higher doses for long periods of time and not supporting the antioxidant system, and you stop the methylene blue, you're going to see people crash. This is what's going to happen. Okay. what I often recommend for most people is that they're starting off at very low doses of methylene blue, talking about 4 milligrams, 8, 12, 16 milligrams, then increasing their dose every 3 to 5 days until they start seeing a benefit. When they start seeing that benefit, do we go up a little bit? Do we not? Everybody's a little bit different there depending on their situation. And that's the art of it all, of course. But once you find that dose that works for them, that's where you stay. It's typically between 8 and 25 milligrams for most people. It's not 50, 70, 100. And so at these lower doses, it's extremely safe. There's no bioaccumulation of methylene blue because the half life is about 4 to 6 hours. And
Oh.
so if you're taking less than about 100 milligrams a day and you have normal kidney function, it should be completely out of your system within a day. Okay. And
Mm,
so, but the majority of people that I work with are taking less than 25 milligrams a day. And if
mm,
they are taking over that, I do recommend typically taking at least 1 or 2 days off per week when you're not taking it, especially if you're reaching about 50 to 70 milligrams a day. Then I usually recommend taking at least that 1 to 2 days off per week. So
mm.
bioaccumulation is not a thing as long as you have working kidneys. If you're on dialysis, it's not going anywhere. So that's
Yeah.
why you don't want to take methylene blue if you're on dialysis. If you have severe chronic kidney disease or even any kidney disease, you really should be working closely with a provider because it's going to stay around for longer than it would otherwise. It's not going to detrimentally affect your kidney function, but if your kidney function gets worse
Mhm,
while you're taking methylene blue, your kidney function, your methylene blue levels are going to be higher as a result of that. So
mhm,
there
mhm.
was a couple of very sort of fantastical papers that came out in early 2025 about taking methylene blue and getting a blue brain, for example. And this was a very great clickbait article. And it was autopsies of patients that had received very high doses of IV methylene blue right before they died. And they had autopsies done within about 4 to 6 hours after they got this IV methylene blue. So IV methylene blue is used as a heroic rescue kind of thing for people with septic shock, with so massive infection, cardiopulmonary arrest, like very severe things, because at very high amounts of methylene blue, you actually can vasoconstrict, you can constrict down blood vessels and sometimes save people's lives. It's very, but
Wow.
it's like a last ditch effort. And so
Mm,
in these patients, they didn't live and they all had above 3 milligrams per kilogram IV, like 250 milligrams of IV methylene blue within a couple hours of death. And all of them, all the ones that they showed in the paper had blue brains because of it. And it's not surprising because of how much methylene blue they gave.
yeah.
Now, under normal circumstances, much, much lower amounts of methylene blue, this is not going to be an issue. Okay.
Oh,
And it's not an issue at all. And it's not something that's going to bioaccumulate or accumulate or wherever you want to say it. So, in essence, short story, not everything that's natural is good for us. Not everything that's synthetic is bad for us. Dosing is super important. And that is definitely the case with methylene blue. And I almost always use very low doses. And the goal is to take them off it over time
mm,
as their body gets more optimized, as their cells get more optimized. And that's a big thing too, is that I'm not saying that everybody should be on methylene blue for the rest of their lives. I'm saying that methylene blue could be a great supportive as you're working on your mitochondrial function, as you're doing your various things to optimize over time. And hopefully you
mm.
need it less over time and just need it more for periodic stress when your body's under more stress and when you have like a long day of travel or a long day of work or you're significantly physically stressed and want more endurance. Methylene blue can help with all those. It's a
Yeah.
great travel hack too, and there's a lot of mechanisms at play there that I can talk about, but I need to stop talking and let you ask questions too. So
Oh,
please.
that's awesome.
Yeah.
Well, it just made me think of um, the the kinds of stories we tell are so powerful and how we tell the story. So I had seen a reel on Instagram sharing this, picture of the blue brain,
Yep.
if, really creating that fear around this chemical. But, and there are, I do want to bring up one other question about some risks of that
Sure.
Chris Masterjohn has shared about how if someone's actually really healthy and their energy production, their ATP production is in good shape. If taking methylene blue is not the best for that type of person because he says that it impacts.
Electron steal. Yeah, that's what he talks about.
Yeah,
Yep. Mhm.
yeah. Can you go?
Yeah.
Can you speak
Sure.
on that? And then and I just think it's great to hear the history that you shared and the fact that it doesn't really bioaccumulate, that there is a half-life and it will get out of your body and your brain is not turning blue if you've taken
No,
methylene
you're
blue.
going to be okay. Yeah. So I think Chris Masterjohn is a fantastic researcher. He's a PhD, and he did a great overview of the biochemistry of methylene blue a couple of years ago, maybe 3 years ago now. But his
Mm.
conclusions are completely wrong, and and that's because he's not a clinician. He doesn't actually see people in practice. He just looks at the data and says, "Well, this is what you should do because of the data." I'm like, "Well, dude, see patients, and you'll see that people don't fit books very often. In fact, they almost never do." And so it's like a classic, even in conventional medicine, you're not going to have a patient present like they do in a textbook. They have all these nuances. It's like not going to happen. And so what Chris is really good at in that particular biochemistry treatise, I call it, it's super cool. He does a really great job talking about the history, talking about the mechanisms, and he goes through how methylene blue can compensate for various aspects of the mitochondria, the electron transport chain not working. Complex one's not working, you can do this. Complex two is not working, you can do this. And methylene blue can actually do almost any of those complexes that aren't working very well. Even cyanide poisoning, which destroys the fourth complex of the mitochondria. That's even cyanide poisoning. The antidote is methylene blue because methylene blue can compensate for that cyanide poisoning and maintain energy production even in that case. Okay, so
Wow.
what Chris is saying here with that as a background is that healthy people should not take methylene blue because it's going to make their electron transport chain actually function worse. Okay, so first thing to say here of that is that there's only 6% of the US population that's metabolically healthy. Okay, only 6%. So even though
Not
you
very
believe
many.
you might be in that, yes, exactly.
It's not a
Even if
small
you
amount.
believe you're in that 6%, probably not. Okay. So that's the first thing. So I think that's the first thing to mention. The second thing to mention is that if you are metabolically healthy, if you're in that 6%, I totally agree. You should not be taking methylene blue all the time. Okay. However, even if you're in that category, you are stressing your mitochondria in various ways where potentially some low dose methylene blue might be helpful. An example would be travel. Okay. If you're going on an airplane, you're pressurizing yourself to about 8,000 feet above sea level. So most people don't realize this. When you travel, as soon as that cabin door closes, they simulate the pressure or the altitude of 8,000 feet. Okay. So your oxygen level, which is at sea level, about 21% oxygen in the air, the rest is mostly nitrogen, goes to about 17%. So immediately, that's why many of us get on an airplane, we feel tired. Why? Because our body doesn't have as much oxygen around, so we don't have as much energy we can make. And then we get to hypoxic stress, low oxygen stress. And that's one of the reasons why we have jet lag when we get to our destination, right? And so that's mitochondrial stress right there, okay? And so what methylene blue can do is actually works just like oxygen if needed and can compensate for that low oxygen level and maintain aerobic respiration, maintain your capacity to make energy from your electron transport chain for longer. And so we have great jet lag protocols that are transformative. I mean, I have had tons of stories. I went transatlantic. I did this. Or even if you're going to altitude, like if you're coming to visit me now in Colorado, all of my friends and my family, they get methylene blue, hopefully before they get on the airplane, but at least before when they get here as well. I was just in Tibet and China at Mount Everest, and I was at base camp. I didn't go to the top. I went to base
That's so
camp
awesome.
at 17,800 feet. And we were using lots of things, but definitely using methylene blue as well as to compensate for that low oxygen level. And I mean, I typically take like on average maybe 4 to 8 milligrams 3 times a week. I don't use it every day, methylene blue. But I use it more when I travel. And I was using 25 to 50 milligrams a day when I was at altitude, and it was really, really helpful. And so optimized, very small amount of us. Those that are optimized can use it periodically. Now, clinically, just haven't seen what he's talking about, which is this sort of energy deficit when healthy people take methylene blue. But it's possible. It's theoretically possible.
Mm-hmm.
So that's why I always recommend if you're metabolically healthy, just take it as needed when you're going to have more stress in the system, and just not take it all the time, and keep the dose
Yeah.
low. Yeah,
Oh, that makes so much sense.
yeah.
With the oxygen piece, so I always think of one of the best things that has helped me on airplanes is doing actually a Wim Hof
Yeah.
breathing. I would do
Okay.
his meditation. I'd listen to it because it would help with the CO2 signaling oxygen in. So is is the methylene blue helping with CO2 signaling, or how does it help with oxygenation?
So what's interesting about Wim Hof breathing, Natalie, is that what you're doing is breathing off a lot of CO2 very, very quickly. Okay. And so you're
Mhm.
actually making yourself actually very alkalotic, which means
Mhm.
that your body's getting very basic. And it's actually harder to get more oxygen to go where it needs to go unless you're doing some sort of muscular exercise. So when you combine WIM with push-ups, that works because oxygen is going to get dumped into that tissue because the tissue is going to be more acidotic and then there's going to be more oxygen dumping that way. But hyperventilating is not the best way to go about it typically because you're going to get less oxygen. Actually, it's going to be able to dump off into your tissue when you hyperventilate. So you feel better because you've increased your sympathetic nervous system and
Mhm.
your fight or flight. And then if you calm down afterwards, you're going to feel more relaxed. But Wim Hof is not what I would recommend on airplanes typically because you're actually decreasing your capacity to get oxygen to your cells. Sorry.
E- Even with, oh, this is so fascinating.
Yeah.
But even with, how does that interact with the lactic acid build? I guess for me, what I thought maybe was helping me
Mhm.
was that it was because it was alkalizing my body, that it was lowering lactic acid buildup and that the anxiety from
What you're
from
really doing, I think, is that you're just basically overdriving your stress response so that
um,
you can calm down afterwards. You know, that's
mhm.
mostly what it is. I think. I mean,
It was
the
really the breath hold that I feel like helped me the most, not the hyperventilation,
mm,
but if with
okay, okay,
for my history,
yeah.
getting to hold my breath longer was harder without
Okay. Okay.
doing the breath
Okay.
hold or the
Okay.
hyperventilation.
Now I get it. So what you're really talking about is CO2 retention training. So you're talking
Yes.
about, so what we do with Wim Hof is you breathe off your CO2 really fast, and then you can hold your breath for long because your CO2 level is so low
Hmm.
that it takes a while for you to get that stimulus to breathe. Okay.
Yeah.
But what you can do over time is you can actually train your breath holding, whether it's through WIM or other mechanisms. And if you can train your breath holding, you have better what's called CO2 tolerance. Your CO2 tolerance gets higher, you have a better stress response, actually. And so
Mm-hmm.
as you're able to increase the amount of CO2 that you can retain, your brain is able to calm down. Instead of getting hyperstimulated at a lower CO2 level, which happens when people have anxiety and and stress,
Panic
you can train
attack.
it to be higher, and then your stress levels won't peak at a lower CO2 level. And so you have this capacity with WIM, also with Buteyko breathing, with oxygen advantage breathing is another one. These are ways you can learn how to CO2 train, and then you can actually keep into a parasympathetic um, state at a higher CO2 level. So that's what you're doing, and
Okay.
that's what it is. Yeah, yeah,
Okay, maybe that was what was,
yeah,
yeah, because it
yeah.
I wouldn't do the hyperventilation that long. It would be
Ah,
more
the
of the
CO2 with
holding.
so you're
Yes.
really you're really doing more like oxygen advantage breathing. There's a guy
Mm-hmm.
named what's his name that does McCune is his last name, Patrick McCune. He's a book on it called The Oxygen Advantage. And a friend of mine named Brian McKenzie who does a lot of breath holds with training, like actually exercise training, because you can actually learn how to keep yourself in parasympathetic longer. And while you're training and exercising, and that'll actually give you more reserve when you're actually lifting or endurance and things like that. So we
Cool.
call it the parasympathetic edge. It's like another topic entirely, but it's a cool way of understanding that if you can drop down your nervous system, you're going to perform better in everything you do. And one of the ways to drop it down is learn how to CO2 train, which is what you're doing on an airplane, it sounds like.
I love it. I love
Yeah.
it. But I love that people can also utilize you have a product of like a little methylene blue breath mint. Is that right? Tell us
It's
about
called the
that.
trochee. Yeah, yeah,
A
yeah.
trochee.
Yeah, yeah.
I sorry.
Yeah, it's all good. It's so I have a company called Transcriptions, and we it actually developed out of the nonprofit that we were talking about earlier. So we have a
Hmm.
nonprofit organization. It's called Health Optimization Medicine, and we wanted to help people right now while they're on the longer path to optimizing their health. And so we created a company called Transcriptions. We created this. We started with this really unique dosage or delivery form called the trochee. It's a dissolvable lozenge that is scored or sort of crossed. It's a cross in the middle, so you can cut it up into quarters, halves, or fulls, so you can find your optimal dose for you. And then a buccal trochee is supposed to go between your upper cheek and gum and dissolve for about 15 to 30 minutes. It's buccal because it's your cheek, and then it dissolves. The ingredients are more bioavailable because they don't have to go through digestion, and also it works faster because it doesn't have to go through digestion, and that's very nice.
Hmm.
The
Hmm.
interesting thing about methylene blue is that in a trochee form, it's great because you really have to care about quality with methylene blue, and I'll talk about that in a minute. But what's nice about in troche form is that you can easily titrate your dose, but you don't have to worry about dissolving in your mouth if you don't want to, because methylene blue is highly bioavailable, which means that almost 100% of it gets in the body, whether you take it orally as a buccal or you swallow it. It's all going to get in the body for the most part. So most people don't want a blue mouth, and that's okay. You can just take the methylene blue and you can swallow it, unless you have significant cognitive issues where methylene blue in the mouth is going to work faster, even if it's the same bioavailability. So you might want to think about using it that way. Your mouth will turn blue. The more methylene blue you use, the more it's going to turn blue, as you can imagine. But on the quality side, real quick on the methylene blue, is that you have to be really careful about what you're getting out there. And we launched our company in 2020. We were the first company to come out with a commercial product back in 2020 that had methylene blue in it. It took us about a year longer to launch than we anticipated because it took us that long to find a good source of it. And the problem with methylene blue is it can be contaminated with heavy metals like lead, mercury, cadmium, and arsenic. You don't want those. And then you want to let the least amount of them as you can, obviously. Of course, if you're eating chocolate, you're getting lead and cadmium too, by the way. So there's heavy metals in arsenic and rice and other kinds of things. It's not just like, synthetic compounds that have these things. It's also natural compounds as well, just to be clear. But you want it to be as small amounts as possible. And then the other aspect of it is that the potency of methylene blue is across the board on most of the products that we've checked across multiple different popularity of various products. Like the liquids tend to be the worst, actually. Liquid methylene blue, the potency is never what it says on label claim. If it says it's 100 if it's a 10 milligrams per dropper or something like that, and then it's probably going to be about 5 to 6 milligrams per dropper on average. So much lower potency. And I hate droppers because people tell me how many drops they're taking, and how many milligrams, and they never have any idea, right? And it's
Right.
like it's very difficult to dose it, understanding what's the best for them. It's very difficult if you don't have that kind of data. So the troche is really nice for that because we homogenize it, we check everything, and this is kind of a bigger issue in the supplement world, and I'm sure you've probably addressed this, Natalie, as well, is that supplement companies don't have to regulate anything. It's not a regulated industry, so they have to regulate themselves. And so if I'm getting an ingredient as a company from another country, we get our methylene blue from Japan, sometimes Korea, it comes in with what's called a certificate of analysis. This is almost any ingredient that's coming in your supplements, by the way, ladies and gentlemen, not just methylene blue, okay? Almost all the ingredients are coming from other countries. They come with a certificate of analysis, which is supposedly an independent analysis of that ingredient, saying that it is what it is, the dosing, the contamination, all that stuff is good. What most companies do is they take that certificate of analysis and they just say, okay, cool, great, I'll put it in our product, and then we'll put it on the shelves, and there you go. But what the good companies will do, what we do, is that we'll test it again independently to make sure it meets the specifications that it said on the certificate analysis that came from the other country. And then when we make the product, we then test it again after the product is done to make sure it's meeting our specifications, so that when we sell a product online, it's exactly what we say it is on the label. And so having that arc and that what's it called, it's knowing all the steps along the road of getting your product to market is so important to me as a clinician, because I want to know exactly what I'm using for my patients, for me, for my family. If I was ever going to get involved in a company that was selling products, it was only under the umbrella of really being able to help people, most effectively now and then long term with the nonprofit too. So yeah, so be careful what you're getting out there. Our methylene blue is some of the best that we've found, and our products are great. We have one called Just Blue, which is like a lower strength methylene blue. We have one called Blue Canatine, which is a combination of methylene blue with caffeine, nicotine, and methylene blue, and or CBD as well in that one. So that's interesting. People may have interesting thoughts about nicotine, but very low doses are very safe, I promise. And then we have also things on the GABAergic side too that help turn the brain off, and calm down that and put those brakes on, as we talked about. So one
Oh,
called
awesome.
TroCalm, one called TroZ. We also have a practitioner brand, a practitioner only line of things. If you're a practitioner, we have a practitioner portal. You can sign up on our website. I'm sorry if I'm just
Fabulous.
kind of going on and on here,
That's
but
great.
yeah,
No, this is kind of the end of our talk too. I'd love to keep talking to you more about this. And I do have other questions. So maybe we'll have you on again. But I'll
sure.
end with our last question, which is, uh, can you leave us, me, and also the listeners, a question for us to ponder this week? What would you like to leave us with?
hmm I like this. This is good. I was thinking about this earlier too. Do you think you need to do more or less to calm down?
Awesome. That's perfect. Just let it sink in, everyone, and really I love this question. It's actually been a theme that I've been writing about in my
Mm,
newsletter. So thank you again, Dr. Sherr. This has been amazing. Um, can you share a little bit more about where people can find you? The
sure.
transcriptions, you have a YouTube channel, and the resource. You have such a wealth of knowledge. It was really fun to get into more of the neurotransmitters.
I love that.
That
Yeah.
was
Yeah.
really fun. I
Yeah.
wasn't expecting to talk about that. It was
I
great.
always love when we go like a little bit of a side direction because it's fun.
Yeah.
It was really a lot of fun. Thank you, Natalie, for having me.
Mm.
So if you're interested in learning about more about me first, I guess it would be my website, Dr. Scott Sherr, my name, DrScottSherr.com. You can just find it. That's, and if you look there, you can look and find my hyperbaric consulting. You can find out about health optimization medicine, my telepractice that I have there. And then the company's transcriptions is the one I was mentioning with the buccal troches and the methylene blue and the GABAergic compounds. You could check it out at transcriptions.com. Our nonprofit is Health Optimization Medicine in Practice. It's HOMeHOPE for short. You can check it out at homehope.org. If you're a
Mm.
practitioner, you don't have to be licensed, but you're looking for a framework. I think we have a fantastic one that we really have developed over the years using metabolomics as that main driver of all of it. And that's the foundational module, the first one that is typically taken by students. And then on the socials at Dr. Scott Sherr, at Transcriptions, at HOMeHOPE.org, those are the places you can find us on Instagram. We also have a pretty big Transcriptions YouTube channel. You can check that out. And then my hyperbaric company is called One Base Health. And it's a technology company that's software that integrates various technologies together in a bidirectional way to optimize your experience. So I think those are the main places. Yeah.
Great. This is so many great resources for people and the all the different treatments that you have talked about are I've seen them to work in a lot of my clients. So thank you again for getting into all of the weeds with it because I
Of
think
course.
a lot of people have the paralysis and the spiral of doom that you talked about, which is so important. Start there, everyone, and have a wonderful day. And hopefully, we'll have you again on the podcast.
Thank you for having me.